Good morning, everyone. We are the Group 2 and we are assigned to do a report about our lab activity number 10, which is Protozoans. Before we begin, here are our goals in this activity. Compare the different protozoal infections based on source of infection, mode of transmission, characteristic manifestation, and vector, and characterize the different malaria infections based on hypnocytes produce type of red blood cell infected, relapse, and CNN's involvement. Protozoa refer to unicellular eukaryotic organisms that are the most primitive among the parasites, like bacteria. Protozoa divide by binary fissions. The classification is based on the mode of locomotion of the different members. Spermozoans are those that hardly exhibit any movement. A member of this group is Plasmodium, which is responsible for malaria. Members of phylum Sacardina, which include the entheologic agent, consist the flagellates, which move by means of flagella. Important members of this group are Giardia lamblia and Trichomonas vaginalis. Balantidium is the sole member of phylum Coleopora that is pathogenic to humans. Motility is by means cilia. Our materials in this lab activity are microscope, demonstration slides, or freshly mounted specimens of the different protozoans.
Good day everyone, I am Melissa D. Acido. So there are two important elements in parasitism, the parasite and the host. Parasites are organisms that usually depend on the host for survival and are classified in several ways, namely based on their habitat. So first one is ectoparasites. Parasites that live outside the host body. Example of this is fleas and lice. Invasion of the body by ectoparasites is called infestation. The second one is endoparasites. Parasites that live inside the body of the host. Example of this is helminths or worms. Invasion of the body by endoparasites is called infection and is the result of entry and multiplication of the parasite within the host. We also have the four types of hosts. So hosts are essential to the existence of the parasite. So the first host is the definitive host, host in which the adult and sexual phase of parasite development occurs. So intermediate host, host in which the larval and sexual phase of parasite development occurs. Third one is reservoir host, host harboring parasites that are parasitic for humans and from which humans may become infected. So the last one is paratenic host, host responsible for transferring a parasite from one location to another.
Under the intestinal and urogenital protozoa, we have subphylum Sarcodina. These organisms have swimming cytoplasm and use temporary cytoplasmic extensions called pseudopodia in locomotion. And under the subphylum Sarcodina, we have Entamoeba histolytica. Entamoeba histolytica is an intestinal and tissue amoeba, and it is the only known pathogenic intestinal amoeba. Its life cycle consists of two stages, the non-motile cyst or the infective stage, and the trophozoite or the pathogenic stage. The trophozoite is found within the intestinal and extraintestinal lesions and in diarrheal stool, while the non-motile cysts are usually found in non-diarrheal form stools. The E. histolytica is found worldwide, but it's more common in tropical countries, especially in areas with poor sanitation. The parasite is transmitted by the fecal route through ingestions of the cyst from contaminated water and food. And water serves as the major source of infection of the parasite. Sexual transmission may also occur when a man has unprotected sex with a woman who has vaginal amoebiasis or through anal intercourse. In the excistation, the ingestions undergo in the ileum where it differentiates into a trophozoite or pathogenic stage. It proceeds to colonize the cecum and colon, becomes converted into cyst, then passed out with the feces. Amoebiasis is a disease caused by the parasite E. histolytica and may be classified into three types of amoebic infections. First is acute intestinal amoebiasis, which presents as bloody mucus-containing diarrhea called the dysentery, accompanied by a lower abdominal pain discomfort. Chronic infection may occur with symptoms such as diarrhea, weight loss, and fatigue. In some patients, a lesion called amoeba may form in the cecum or in the rectosigmoid area of the colon, which may be mistaken for a malignant tumor in the colon. And the second is extraintestinal amoebiasis, when the parasites enter the circulatory system, and the most common form is the amoebic liver abscess, characterized by right upper quadrant pain, weight loss, fever, and tender enlarged liver. And asymptomatic carrier state is the patient with no symptoms but reproduce and pass out parasite in feces.
Let's proceed to Giardia lamblia or Giardia intestinalis, which is under the classification of subphylum Mastigopora. Important properties and life cycle. Giardia lamblia is an intestinal protozoan initially known as Cercomonas intestinalis and Giardia duodenale. The parasite life cycle consists of two stages. First is the trophozoite. It is a pear or teardrop shape with 4 pairs of flagella and has a motility likened to a falling leaf. Second is the cyst, which is typically oval and thick-walled with 4 nuclei. Epidemiology and pathogenesis. Giardia lamblia is a worldwide distribution through contaminated water sources. The disease can thus occur in outbreaks related to contaminated water supplies, and about 50% of infected individuals do not present with symptoms and serves as carriers. Also, other than humans, many species of mammals may act as reservoirs, and the infection is common in those engaging in oral to anal contact. High incidence has been seen in daycare centers and mental care facilities. The parasite is primarily transmitted through ingestion of the cyst from fecally contaminated water and food. Damage to the intestines is not due to invasion of the parasites but because of the inflammation of the duodenal mucosa, leading to diarrhea with malabsorption of fat and proteins. The trophozoites may also infect the common bile duct and gallbladder. Disease, Giardiasis. A symptomatic carrier state is usually completely asymptomatic. The infected individual unknowingly passes out the parasite with the feces, which can contaminate water. Giardiasis, or traveler's diarrhea, is characterized by a non-bloody, foul-smelling diarrhea accompanied by nausea, loss of appetite, flatulence, and abdominal cramps. The symptoms may persist for weeks or months. Malabsorption of fat may lead to the presence of fat in the stool, called dysuria. Manifestation may vary depending on which nutrient becomes deficient due to the resulting malabsorption. Infection is a self-limiting that lasts 1 to 2 weeks. Relapse may occur especially in patients with immunoglobulin A deficiency.
Trichomonas vaginalis is an anaerobic flagellated protozoan parasite and the causative agent of trichomoniasis. It is the most common pathogenic protozoan infection of humans in industrialized countries. Subphylum Mastigophora or Trichomonas vaginalis. The important properties and life cycle. The parasite is a pear-shaped organism with a central nucleus, 4 anterior flagella, and an undulating membrane. It's not an intestinal pathogen. It causes urogenital infections, and the main mode of transmission is through sexual intercourse. Infection in men, usually asymptomatic, and men serve as the reservoir for infection in women. Infection in women, also asymptomatic, may present with scant, watery vaginal discharge. The discharge may be foul-smelling and greenish-yellow in color. This may be accompanied by itching, burning sensation in the vagina. The cervix appears very red with small punctuation hemorrhages giving rise to a strawberry cervix. Infection in infants occurs as the infant passes through the infected birth canal of the mother during vaginal delivery. The infected infants may manifest conjunctivitis or respiratory infection. Diagnosis is made by the finding of the characteristics protozoate in a wet amount of vaginal or prostatic secretion, urine, and urethral discharges. The drug of choice for treatment of trichomoniasis is metronidazole. All sexual partners of an individual with the infection must be simultaneously treated to prevent ping-pong infection. The best way to prevent infection is the practice safe sex. The use of condoms can limit the transmission of the parasite. Health and sex education are important too. Maintenance of the acidic pH of the vagina may also be helpful.
Phylum Ciliophora, Balandinium coli. Important properties and life cycle. Balandinium coli more complex than E. histolytica, the largest protozoan to infect human. Infective stage, cyst containing 2 nuclei, micronucleus, not readily invisible. Pathogenic stage, protocyte which invade mucosal lining of the terminal ileum, cecum, and colon. Rotatory boring motility and 2 nuclei, small donut micronucleus and kidney-shaped micronucleus. Epidemiology and pathogenesis. Worldwide distribution. Pig, most important and common reservoir. Monkey, occasional reservoir. Main source of infection. Contaminated water with pig feces. MOT, fecal-oral route. During outbreaks, person-to-person transmission via food handlers. Cysts in contaminated water, indigested, encystation in the SI. Trophozoite travel to the LI, produce ulcers. No extra-intestinal involved. The disease from the balandiasis. Most are asymptomatic. Dysenteric type of diarrhea resembling amoebic dysentery with high parasite load. Acute infection, liquid stool containing pus, blood, and mucus. Chronic infection, tender colon, anemia, wasting, and alternating diarrhea and constipation. Extraintestinal infection, rare, may involve liver, lungs, mesenteric nodes, and urogenital tract.
Blood and tissue protozoa. Subphylum Sarcodenia, Acanthamoeba or free-living amoeba. Important properties and life cycle. Acanthamoeba castellani with Neisseria are minor protozoan pathogens. Acanthamoeba causes infection in immunocompromised. Free-living amoeba is causing inflammation of the brain substance and meninges or meningoencephalitis. Source: widely found in soil-contaminated fresh lakes and other water environment or survive in cold water. Cyst-infected stage and trophocyte pathogenic stage. Epidemiology and pathogenesis. 2 ways of occurring. Through aspiration or nasal inhalation. Cyst from dust has been shown to occur through direct invasion in the eye, usually while swimming in contaminated water. Trophocyte enter through the lower respiratory tract or ulcers in the mucosa or the skin. Parasites then migrate through the bloodstream and invade the CNS. Eye infection primarily occur when wearing contact lenses. Source of contact lens user, contaminated tap water. Disease. Granulomatous amoebic encephalitis immunocompromised and also cause brain absence. Symptoms develop slowly headache, seizure, stiff neck, nausea, and vomiting. Brain lesions may contain trypocytes and cysts. Rarely may spread producing granulomatous lesions in the kidney, pancreas, prostate, and uterus. Keratitis infection of the cornea. Symptoms severe eye pain and vision problems. Loss of vision due to the perforation of the cornea. Labellum sarcodania niglia. Important properties and life cycle. Free-living protozoan found worldwide in soil in contaminated water environment. Survive in thermal spring water. Niglia flower only amoeba with key forms. Number 1. Trypocyte. Exhibit typically amoeboid movements slug-like. Amoeboid trypocyte is the only form known in human. Flagellate pear-shaped equipped with two flagella for the jerky or the spinning movement. Number 3. Cyst. Non-motile form. Niglia infection occurred transiently when swimming in contaminated water. Parasites penetrates nasal mucosa and cryptform plate, enters the CNS, and produces the fatal meningitis and encephalitis. It produces infection in healthy children. Parasites can be acquired through inhalation of dust containing parasites. The entire life cycle occurs in the external environment. Amoeboid trypocyte, flagellate trypocytes, amoeboid trypocytes, and last cyst form. Disease. Asymptomatic infection, most common clinical presentation with colonization of nasal passages. Primary amoebic meningoencephalitis or PAM, colonization of the brain by amoeboid trypocytes leading to the rapid tissue destruction. Initial complaints, sore throat, nausea, vomiting, fever, and headache. Later development, meningeal irritation, and alternation in the sense of the smell and taste. Untreated may die within 1 week after the onset of the symptoms. Sabpilum mastigopora or hemoflagellates, Leishmania spp. The important properties and life cycle are Plebotomus and Lutzomia genera. A female sandfly are vectors involved in the cycle. Leishmania spp is obligate intracellular parasites for the wild distribution and natural reservoir are rodents and anteaters, dogs, and cats. The L. tropica is cutaneous and L. brasiliensis is mucocutaneous. L. Duvani complex causative agent of visceral leishmaniasis or Kala-Azar or Dum-Dum fever. Complex consists of L. donovani chagasi in Central America, L. donovani in Africa and Asia, L. donovani infantum in Mediterranean Europe. Birth are transmitted by Plebotomus sandfly and this. The disease in visceral leishmaniasis, Kala-Azar or Dum-Dum fever incubation period is 2 to 8 weeks, up to 18 months. Disease begins with intermittent fever, weakness, and weight loss. Splenomegaly, massive enlargement of spleen, is characteristic, leads to hyperplanism or anemia. Hepatomegaly, this is enlargement of the liver. Kala-Azar or black sickness or fever, it is hyperpigmentation of the skin on light-skinned patients. BM involvement leads to destruction of cellular components with clinical symptoms. Anemia, destruction of red blood cell, thrombocytopenia, this is bleeding tendency due to reduce of platelets. Leukopenia, increased risk for secondary infection due to reduction of white blood cell. Glomerulonephritis, inflammation of the glomeruli, fatal disease if untreated.
Protozoa cruzi is found primarily South and Central America. It is transmitted by the bite of the radubid or triatomid bag, triatoma or cone nose, or the kissing bag. It is usually transferred to a human host when the feces of the bag containing the ineffective trypomastigotes is deposited near the bite site. Feces are introduced with the bite site when the host scratches the bite area. The other route of transmission include the blood transfusion, sexual intercourse, transplacental transmission, and through the mucous membrane. The reservoir hosts are the domestic cats and dog, armadillo, raccoon, and rats. Chagas or American trypanosomiasis is a disease caused by the T. cruzi. In the acute phase of the disease begins with a nodule or chagoma near the bite and unilateral swelling of the eyelid with conjunctivitis or the Romanos sign accompanied by fever, chills, malaise, myalgia, and fatigue. In the chronic phase, characterized by hepatomegaly, lymphadenopathy, and myocarditis with cardiac arrhythmia. Trypanosoma brucey and T. brucey rudescensi. These two species are similar in morphology and life cycle. The vector are the tsetse or Glucina, and the reservoir are humans for T. brucey while the reservoir of T. brucey rudescensi are the domestic and wild animals, especially cattle. The T. gambiense infection is chronic, the West African or Gambian sleeping sickness. The causes of disease along the water courses in West Africa. The initial lesion is indurated ulcer called chancre at site of bite and intermittently weekly fever and lymphadenopathy. And in the T. rudescensi is more rapidly fatal East African or rudescensi sleeping sickness. The cause of disease mostly in arid regions of East Africa. There is no lymphadenopathy and central nervous system occurs early in the course of the disease. Death is usually within 9 to 12 months following infection in untreated patients and may be due to glomerulonephritis and myocarditis.
In the tabulation number 2 is compare the importance of protozoan. In the parasite Entamoeba histolytica, the source of infection is contaminated food and water, while the mode of transmission is fecal oral route, while the characteristic manifestation is occasional diarrhea, weight loss, fatigue, right upper quadrant pain, and fever. In the parasite Naegleria sp. The source of infection is soil and contaminated water, while the mode of transmission is transnasally when swimming and contaminated water, while the characteristic manifestation is sore throat, fever, and headache. In the parasite Acanthamoeba sp. The source of infection is soil-contaminated freshwater lakes and water environment, while the mode of transmission is aspiration nasal inhalation, direct invasion in the eyes. In the characteristic manifestation is headache. In the parasite Gargalambia, the source of infection is contaminated water source, while the mode of transmission is oral anal contact, while the characteristic manifestation is non-bloody, foul-smelling diarrhea, nausea, loss of appetite, flatulence, abdominal cramps. In the parasite Trichomonas vaginalis, the source of infection is toilet article, clothing of infected individuals, while the mode of transmission is sexual intercourse. In the characteristic manifestation is inflammation, the state watery, vaginal, discharge, respiratory, and infection. In the parasite
Trypanosoma cruzi. The source of infection is bite of kissing bug scratch the bite area with feces. In the mode of transmission is bite of kissing bug. In the characteristic manifestation is fever, chills, and fatigue. In the parasite Trypanosoma brucei, the source of infection is cheche fly, while the mode of transmission is insect bite, while the characteristic manifestation is weekly fever. In the parasite Leishmania donovani, the source of infection is bite of sandfly, while the mode of transmission is injection into human rosin, while the characteristic manifestation is fever, weakness, weight loss, enlargement of spleen in the liver. In the parasite Toxoplasma gondii, the source of infection is ingestion of raw meat and contaminated water, while the mode of transmission is sharing needle by IV drug blood transfusion. In the characteristic manifestation is chills, fever, headache, and fatigue. In the parasite Plasmodium, the source of infection is blood transfusion, straining of IV needles, needles, placental, and transmission. While the mode of transmission is bite of female mosquito vector, while the characteristic manifestation is abrupt onset of chills, headache, and muscle pain, joint pain. Indicate the vector for each of these parasites. Number 1, Trypanosoma cruzi. The answer is kissing bug. Number 2 is Trypanosoma spp. The answer is cheche fly or glossina. Number 3 is Leishmania spp. The answer is sandflies. Number 4 is Plasmodium spp. The answer is female Anopheles mosquito.